Good morning. Today is Thursday, March 18th, and this is our weekly COVID-19 update briefing. Today in Bossier Parish, unfortunately, we have up to 13,174 positive cases, which is an increase of 64 since our last report. And also, we now have experienced 281 deaths, which is an increase of 6 since our last report. And unfortunately, at the state level, we're almost at 10,000. Reported this morning that we had a total of 9,955 in the state deaths so far. At his press conference Tuesday, March 9th, Governor Edwards announced that we have met the federal gating criteria to move us into phase 3 of the recovery effort. So that is in effect from March the 3rd through March the 31st. And some good news is that in the most recent percentages of positive cases as of March the 10th is now 2.10, which is well below our goal of 5% or less, and that is really good news. Tuesday, March 9th, the state expanded eligibility for the COVID-19 vaccines to include people with health conditions that may result in a higher risk of disease. So persons between the ages of 18 and 64 that have one of the previously announced medical conditions are now eligible to receive the vaccination. Individuals age 16 and above are eligible if they're using the Pfizer vaccine. And lastly, individuals who are pregnant are eligible regardless of their age. Now, as of today, there are at least 3 general categories of eligibility. I'm not going to go over all these because it's an extensive list, but just by category. One is by age or condition. The second is people with certain medical conditions, and 3 by workforce. Details of these categories are normally available by contacting the Louisiana Department of Health or calling 211 or other sources. Yesterday, Moderna began studying its COVID-19 vaccination in children aged 6 months to 11 years. This test is being done in the United States and in Canada in an effort to widen the mass vaccination campaign beyond adults. The first dose in this test was conducted yesterday. As most of us know, the Johnson & Johnson vaccine has become a major positive factor in addressing the pandemic. It only requires one shot and does not require special temperatures for keeping it available to everybody without any special refrigeration, I should say. It's proven to be very effective in severe COVID-19 diseases, and there is a 4th vaccine being considered, the AstraZeneca, but it is under development and somewhat controversial at this point and not approved in the United States. But the gap between supply of vaccines and the demand is narrowing, and that is very encouraging. The impacts of the variants that are surfacing is not yet clearly known, but they are a significant problem. Some medical experts say that these existing vaccines we got are effective against these variants, but they are still require more study. The CDC, Center for Disease Control, has indicated that the variants that in the United Kingdom and from South Africa are more contagious than the original virus, and they transmit at a higher rate, which results in more people getting the virus, more hospitalizations, and regrettably more deaths. There's speculation that the United Kingdom variant may soon become the predominant strain of the virus. The projection for when the general population can obtain a vaccination has recently improved. It is now projected to be in the May through July timeframe. President Biden recently stated that the United States will have enough vaccine for every adult by the end of May. I might point out this does not necessarily, the vaccinations will have been administered, but the quantity of vaccines available will be projected to be in quantities to adult into our general population. And he has also set a goal of vaccination for all teachers in the month of May. While we are in this pandemic, it's of note that the federal government has confirmed that vaccines are available to those who need them at no cost to the individual. It's estimated that approximately 75% to 85% of the populace being vaccinated is required to achieve herd immunity, and the effectiveness of our vaccines will be minimized if large numbers refuse the vaccination. The numbers of individuals who are asymptomatic is about 50%. They do not develop or show the symptoms, but they can have the virus and can spread it to family, friends, and others, and with serious illness and death potentially. There has been some change in the guidance for wearing a mask. The governor recommends that we continue having every individual in Louisiana age 8 or older wearing a face mask covering the nose and the mouth when inside a commercial establishment or any other building or space open to the general public, which includes public or commercial modes of transportation. And also the CDC now recommends that children 2 through 7 wear masks. The CDC has also released some improved guidelines for visitation of persons who have had the COVID. If they've had the COVID and 14 days have expired, they can now visit with family members and hug and kiss and whatever, but that is a significant improvement. Also, I learned that there's an evaluation being made about the feasibility of reduction of the recommended social distancing from 6 feet to 3 feet. That is not firm yet, but that is being considered, I've read. The Center for Disease Control and the Louisiana Department of Health have determined that the number of days a person should remain in quarantine can be shortened to 10 days on day 11 if no symptoms have been reported during the daily monitoring. They also say it can be shortened to 7 days on day 8 if the individual takes the COVID-19 test and receives a negative report. And it's hoped that these shorter quarantine periods will encourage more people to receive the vaccination. But the Louisiana Department of Health still recommends quarantine for residents and staff of congregate living facilities such as nursing homes and correctional facilities. That quarantine period remain at 14 days is their recommendation. Ladies and gentlemen, the prevention and mitigation protocols are still recommended or unchanged, and they are as follows. Wear a mask. Wash your hands. Social distance at least 6 feet. Do not touch your face. Disinfect surfaces which are frequently touched, such as handrails, doorknobs, computers, etc. Cough or sneeze into the bend of your elbow. If you're sick, stay at home and follow the advice of your medical provider, and as always, avoid crowds. As the United States continues its race to vaccinate as many people as possible, the House just passed a bill that would grant the Department of Veterans Affairs the authority to vaccinate all veterans and caregivers of veterans at the VA. That is a significant change also. I also want to thank all of you for continuing your positive involvement in our fight against this deadly pandemic. There is light at the end of the tunnel, but we're not through the tunnel yet. There is concern that the recent spring break from colleges and schools may cause a surge, and this is being monitored very closely to see if the spring break was going to cause any sort of a surge. Our next briefing, ladies and gentlemen, will be next Thursday, March the 25th, and this concludes today's briefing. Thank you and good day.